So after watching the video on hepatic encephalopathy, what surprised me the most was just how much independence that this disease can take away from someone. I feel like there's a lot of uncertainty with this disease. They don't know how they're going to be acting, how they're going to be feeling when they're going to go into a coma. It kind of takes away their ability to have a job. It impacts their family's relationships. They don't even have control of their behavior anymore. So I think just seeing that loss of control, and also I guess it was just surprising to see how many like systemic effects of the disease there were just on their family, their community, and just everybody else. It's definitely not something that's just locked down to the patient. And then for a social determinant of health that is potentially affecting some of the families that were present in this video, I was thinking a lot about economic stability. Like I just said, they have like a huge loss of independence, and there's a lot of things they can't control anymore, which I think would make it very hard to work a job that would be able to, cover their personal needs, cover their medical expenses. One of the families in the beginning of the video was just totaling some of their expenses. They had one bill that was over $8,000 and insurance was covering $2,000. That is just, it's a huge burden for anybody, let alone if you're a caretaker and your time is split between, taking care of your loved one, working, raising your family, any other commitments you have. I don't know how the families are doing it. The same thing with the other family whose mom had hepatic encephalopathy. She was working full-time. She was a single mother, I believe, and also trying to support her mom. I just think that the economic component of this is just a huge barrier for the patients and their families, and I just think it makes this disease so much harder. As for interventions for chronic disease, I think one of the biggest things you could do is education, not only just for the patients, but for the families. I think if people have a clear understanding of their disease, the treatment, the course, it just puts everyone on the same track. One of the sons of the men on the video, when they asked him about hepatic encephalopathy, all he said that he knew was that his dad needed a liver treatment or transplant. But then he's having to watch his dad have, behavior changes and go into comas, and I think that's just really confusing and hard to see if you don't know what's happening. So I think maybe just bridging some of the education gap could help families and patients just know what they're expecting, that kind of thing. Then the other intervention that I think would be really important with this disease and any chronic disease is, checking in on your caregivers, assessing for caregiver burden, and providing resources to family members or any kind of caregivers. Chronic illness is a long-term thing, and the people who step up into that caregiver role, like I've mentioned before, are having to play so many different roles. They're working, they're being a caregiver, they're raising families, and I'm sure they have other commitments. So just learning to balance all of that is a lot for any one person, and the stress that comes with that, I think, is just a huge load. So as a nurse, I think you're just as entitled to caring for their families as the patient, and I think the patient fares better too when caregivers are being taken care of. So just doing what you can. I think simply just even checking in on them, addressing their needs, like I said, providing resources maybe that can help relieve some of the burden, whether that be finding someone to fill that caretaker role, or even just finding resources that maybe could eliminate some of their financial stress, would be huge. So yeah, education and checking in on your caregivers are just two of the things that came to my mind when thinking about some of your interventions.